Aloha, aloha mai kākou. Welcome to another episode of from ʻAha Wahine Kūhinapapa. We're real excited to present to you three amazing wahine and their stories. October, as many of you might know, is Breast Cancer Awareness Month, and something that's a really important topic for Native Hawaiian women. So we're going to have a lively conversation tonight. But meanwhile, while we're waiting for a few others to join in, or you can join us on Zoom, you can join us on Facebook. Let us know where you're calling in from. I already see a few friends in the audience, so aloha nui, aloha to you all. And we'll be starting in just a moment. You might be viewing this via Zoom, mahalo. You might be viewing this on Facebook. We are live streaming across about 10 different platforms. We're glad you're here. Be sure to tune in. Great, I see lots of friends and future friends joining us as in the audience. So mahalo nui. We'll be starting in just a moment. Let us know where you're calling in from. But I just see somebody is calling in from Kaimuki. Leimaile is here from Kaimuki. Aloha. Aloha, Wahine Aipohaku. I hope you are well. I'm glad to see you. Kauai, Kale from Kauai, nice to see you. Mahalo for joining us. We'll get started. Well, let's go ahead and get started. Welcome to a new episode from ʻAha Wahine Kūhinapapa, sharing more teachings from women in our community. ʻAha Wahine Kūhinapapa is, our members are all volunteer hui of wahine, representing multiple generations across the public and private sector. This new season is presented with the support of many sponsors: Hawaii People's Fund, Oiwi Television, Papaʻolalokahi, the University of Hawaii, the Roots Program at Kokua Kalihi Valley, Ho'oluʻaina in the back of Kalihi Valley, and Ko'olauʻaina Momona. Mahalo to all of our sponsors. We have a few housekeeping details. This webinar is being recorded and live streamed across many different platforms. After today, you'll find it archived on the ʻAha Wahine website. The same website that you used to sign up for this presentation. Questions can be put into the Q&A panel at the bottom here, and we will throughout the hour take the questions and address them to our panelists. If you're viewing on Facebook, go ahead and put them in the comment section, and our team here will be scanning Facebook to make sure we get all of the questions that you post there. There will be an evaluation that will be sent at the close of the webinar and then again tomorrow. So evaluation will be sent at the close of the webinar and then again tomorrow. Please fill that out. It gives us an idea of what resonates with you, our audience, what you want to, we give you an opportunity to tell us what programming you would be interested in seeing that we haven't had so far. So don't forget to fill out that evaluation. Mahalo nui. So tonight, October 2022, the title, Wāhine Warriors, Journeys with Cancer. And we're going to focus more on the journeys and not so much the cancer. Tonight, these three wahine, my friends, will be sharing their very personal stories. Jamee Miller is the Director of Community and Aina Resiliency Ko'olau at the Kamehameha Schools and founder of E Kolumea Nui, a social justice organization. She is a daughter, a mother, a grandmother, and a sister. Kaʻiulani Odom is the Director of the Returning to Our Roots program at Kokua Kalihi Valley Community Health Center that oversees Roots Cafe and the Food Hub. She's also a Lomi Lomi practitioner, a registered dietitian, public health educator, and hula practitioner. JoAnn Tsark is a public health educator who currently leads the Community Engaged Research Core at Ola, Hawaii at the John A. Burns School of Medicine. And she's the former director of research at Papaʻololokahi, where she established ʻImi Hale, the Native Hawaiian Cancer Network. So to all of you, aloha.
Aloha.
Let's start out by just getting to know you a little bit. I wonder if you can, I know the KKV practice is to bring somebody in with you, and I wonder if you could tell us a little bit about who you are, where you're from, and where your ancestors hail from. Where is your ancestral homeland or homelands?
Sure. Aloha, I'm Kaʻiulani Odom. I currently reside in both Kapu and Kaneohe on the windward side. My mother is from Hunaka'a, Hawaii, and my father is from Kapa'a, Kauai, and they actually met while they went away to school and stayed up there for a few years. So I was actually born in Colorado Springs and didn't come back over till I was, I think, 3 years old. And we came over on the Lurling. That's how we came back to Hawaii.
Awesome, Kaʻiu. Mahalo nui.
I can go next. Aloha, everyone. Jamee Miller. I am born and raised in Punalu'u, Oahu. I reside there as well right now with my husband. We're empty nesters. We have big pukas in our house because nobody's here, just he and I. But my family, my ancestral home is on Hawaii Island in Ho'okena, where my kupuna are from, and on the Hilo side of Hawaii Island. Mahalo.
Awesome. Mahalo, JoAnn. Oh, are you muted, JoAnn?
Aloha, everyone. Yeah, can you hear me now, Kim?
Yes, we
Okay, fabulous. Hi, I'm JoAnn, born and raised in Palolo Valley, left recently and now live in Olomana, beautiful east side of the island. I'm the product of Clarence Aliang Tsark and my mom, Josephine Kukawalino. Those are my makua. And I bring my mom with me tonight because she's quite the inspiration, and you'll learn more about her connection to the story I want to share with everybody tonight. Thanks.
Oh, beautiful. Yeah, I look forward to hearing more about Auntie Jo.
Yeah.
So I know I forgot to introduce myself. I'm Kim Ku'ule Burney. I'm a member of the planning committee for ʻAha Wahine Kūhinapapa, and my day job is with the Hawaiian Health Organization. So this is a topic that is very important to those of us that are in Hawaiian health, and I'm really pleased to be able to be talking story with all three of you. And to be able to share your stories with a wider audience, because there's so much that we can all learn from your journeys. And thank you for your willingness and your openness for sharing tonight. And I wonder if we could just start, Kaʻiu, I wonder if you would like to start out by telling us your journey started only a year ago.
Yes, I was just saying that my biopsy was on October 28th. So almost exactly a year ago, I was diagnosed with breast cancer, and it actually came as quite a shock. It wasn't something that I thought I was going to get. And I actually hadn't had a mammogram in 10 years. And to credit my doctor's office, they would call every so often and say, you need to schedule this. And I finally went in, and even after, they said, oh, we think you should come back. We want to, take another test. They called me the next day. And I still wasn't really thinking that this is something I was going to get. But then I started to think back, and looking back, I had realized that over the year or so, there were a couple of times where I thought, oh, I wonder if something's going on. And, and I did a breast check and I didn't feel anything. And so, I went in for the biopsy on October 28th last year, and I happened to be going to Las Vegas the next day to visit my daughter and her family. And I was told, oh, you will get the results in 3 days and your doctor will know by then. So by that time I was in Las Vegas, and I was really on pins and needles the whole time, because every time my phone rang, I thought, oh, I'm going to get the results. And I hadn't said anything to my family at all because I didn't want to worry them unnecessarily. And I stayed in Las Vegas for over a week and nobody called me. And so I came home and again waited for a call and still nobody called me. So I want to say about 10 days after my biopsy, I finally called my doctor's office and I explained to whoever was answering the phone that I had had the biopsy. I was waiting for the doctor to give me the results, and she put me on hold and she went off, and my doctor came on and he picked up the phone and he said to me, is there someone that you have that can take care of this? And that was the first words he said to me. And I was like, whoa, wait a minute, like, let's back up. So apparently it's positive, and I actually really like my doctor. He's my friend, but in this moment, this time, I just felt like my head was spinning and I was trying to think. And so he's telling me, and what happens too is when you get diagnosed like that is that you don't go and make your own appointments. So he, told me who the breast surgeon and specialist was that I was going to go to, and told me that he would give them my name and I had to wait for them to call. And, when you get a diagnosis, you want to start doing something. And so to have to sit and wait is just absolutely nerve-wracking. And I remember somewhere along the line saying to him, well, how worried should I be? And his answer to me was, well, it is cancer. And so I hung up the phone and I was like, wow, I just had this really terrible sinking feeling. And I immediately, and I sat for a few minutes and I, thought, what am I going to do? And so I called my friend Puni up at Ho'oluaina and I told her, and she was like, don't worry, you got this. We're gonna take care of it. And she sent down La'au immediately that evening to me, and we started my journey with La'au, and that was one of my pathways. And she would support me throughout that. And then I called my naturopath. And we set up an appointment for a couple of days. And when I got her on the phone, even though I'm a dietitian from a naturopathic point of view, we really honed in on my diet and what could we do to provide the most protection in my body as I was waiting to go in to see the breast surgeon, and how could we make my body stronger so whatever I was facing. And so, really talking about all the protective types of foods that I should be eating, the cruciferous vegetables, the berries, the mushrooms, all these things that, we really went through that. I took a certain course of supplements that were also to help my body, different things. And I called a couple of other healers and practitioners and talked about it. And I called Diane Paloma, who, I know had gone through this and didn't mind sharing her story. And she really talked me through it. And she was like, don't, we're going to support you, call me anytime you need. My other healing friends were like, don't worry, you got this, we're going to get you through this. And really, kind of what you want your doctor to be saying to you. But I was lucky that I had a group of people that surrounded me that really I depended on a lot throughout this whole process to go through. And so what I, really learned through that diagnosis was, and I've thought about it actually quite a lot, is that if you just depend on the medical system, and if I had to just do that and just sit and wait, I would have been really anxious. But I was able immediately to start taking on things that I thought I could do for my health. And then when I finally got in to see the breast surgeon, which was breast specialist, was about 10 days later, she was great. She sat me down, she showed me all the images, she talked me through what was going on in my body. And most breast cancers are ductal, and mine was lobular. And she said quite often they don't even show up for a while. They're often felt before they're seen. And so I was really lucky that I was, categorized as stage 1A. It was very early on. She went through all of the things that I needed to think about. And it was finally at that point that I felt like I had a real good idea of what my course of action was going to be with her. I knew what I was going to be doing with La'au, and I was going to continue working on strengthening and building up my body. And so that was all within, the first 10 days of being diagnosed.
Those are some beautiful lessons there, Kaʻiu. Number one, that you did reach a medical practitioner who was with you all the way, right? Who helped plan a course of action with you. I love that you brought in your the La'au, and you didn't say Lomi Lomi, but you brought in other practitioners as well, right? But you know what you didn't, well, you kind of did, the sense of community, that you didn't just keep it to yourself and, and close up and not tell anybody, but you started to share as needed, as you needed, and you really built that supportive community right away. And I think that that is one of the important lessons. And you've already identified so many wonderful lessons in just the first 10 days of your experience. Great, good. Let's talk more about, I want to get to one of the other questions that I have about how normal is that 10 days. And I think when we get to JoAnn, I'm going to ask her some of these questions that, that you're bringing up. But Jamie, I wonder, your experience started right about the same time Kaʻiu's did, and you two had something to share.
Yeah. Let's see. My grandmother, my mother's mother, died when my mother was 5 years old because of breast cancer. When my daughter was 5 years old, she's 33 now. My mom got diagnosed with breast cancer. And then about 15 years later, she got diagnosed again, second time with breast cancer. So by that time, we had known that, that I was at high risk. Me and my sister were high risk. And so I had started going to doing regular mammograms and going to the breast cancer high risk center with Kaʻiulani. And I had been with them for about 2 years prior to my diagnosis. And so, but when COVID happened, I had missed one appointment. So I was going every 6 months. I would get a mammogram once a year and then do an MRI 6 months later. So once a year, I do a mammogram, and once a year, I get an MRI. I had missed the MRI. And so I showed up for my mammogram last year. My birthday's in November. I showed up in October, end of October, because I was gonna be gone during my birthday time. And I had felt a little lump. And it just was, a little peculiar. I asked my mom to feel it. And she said, yeah, you should go, make sure you go get it checked. So I went and I did a mammogram. I can give you the results right there at the high risk center. And so they told me, it looks very peculiar and suspicious. We wanted to do a biopsy. So, let's schedule a biopsy. So it was just a few days later, I went back in for a biopsy, and they did 2 types of biopsies, a regular one that, we all know. And then another one was a ultrasound biopsy. So I was upside down, and they did it that way. And then I went away, and I was a little nervous, but you just kind of have a gut intuition that it is going to come back positive. And so I just was kind of preparing myself mentally for that and for the call. And so, so I called Kaʻiu during this time that I was waiting, which was only a few days. And I told her, I'm going to go on a trip, but I'm kind of nervous. How are you doing? I hadn't known that her diagnosis, and I shared with her, I said, I'm waiting for a biopsy. I'm kind of, a little bit stressed out and worried about it. And she told me the same thing about her. And then she was like, yeah, I did mine like a week ago. So I was about a week behind of Kaʻiu. And so throughout our journeys till this day, we still call each other about different things and kind of contrast and compare. our experiences. And so I had a different type of cancer, stage 1A as well. And my course of treatment, I could have done a lumpectomy and then radiation after, but I also have asthma in my family. And although my asthma is under control, I really didn't want to do radiation. So I opted to do a double mastectomy, and plus my, in our history, and I did all the genetics testing, and I do not have the genes, but the known genes anyways, that gives you breast cancer. And so I decided to do the double mastectomy because I'm still young, and the chances of it returning, are higher for me. So I just wanted to take that out. And if during the surgery, if they didn't find anything else, then chances were that I didn't have to do radiation. And that was important to me, that I did not want to do radiation. And so I just really wanted to do surgery. So I did do the surgery. And so I did it in January of this year. So I got diagnosed in November, and I did it in January. And every doctor appointment I had between being diagnosed in November to January, everyone asked, like, why, how come you haven't done your surgery yet? Why did it take so long? Why? And it was really bad because it was around holiday time, and my surgeon and my two surgeons were on vacation and holidays. And anyways, and they were the same. I think Kaʻiulani was the last one they operated on before they both went on. We ended up having the same surgeons before they went on vacation. And then so I had to wait till they came back in January, which I didn't mind. I wanted to read up a little bit more. I knew that I was going pretty extreme and drastic. And I had talked to Diane as well. And so, I kind of needed that time to prepare, that, actual body parts were going to be taken off of me, and that I needed to be okay with that. And I was, and my family was very supportive. But, I would talk to Kaʻiulani like every week, and she would share her la'au with me, share with me what she's eating. And so I got to get some free advice from her that she got from all these other practitioners, and people were sending me stuff. Some of our mutual friends were making me very healthy luau, sending me kalo. I really felt the community behind me, and my family behind me. And then it, started our journey around really being vigilant around screening, how important screening is, and how important it is to listen to your na'au and your gut, and not being afraid to share the story. I know when my mom had cancer, she couldn't even say cancer. She would go and she would start to cry because she just, I think went back to her childhood, that her mom died of cancer. And then I remember when she got cancer, she said, "I'm so sorry that I'm passing this on to you and your daughter." I said, "You don't know that. We may not get it." And so, for me, it was, I was just like very open with my sister and my granddaughters, 2 granddaughters, my daughter, and making sure that, they know that this is survivable now, and we just need to take care of ourselves ahead of time, and listen to, what our bodies are telling us. And then having that support system, it was I felt very, very fortunate that Kaʻiulani and I were, and although we didn't do the exact same types of treatments, but we walked the journey together. And I can't imagine having to do this alone, or just having the internet, because I was like going down deep holes looking at, mastectomies, and that you should not do that, by the way. But so it was a very healing and supportive time going through all of this. And it's been a year for me too.
It has. Wow, Jamie, that's beautiful, especially the way your family and your community came around you. I know this is kind of a personal for the family question, but now is your daughter and sister, are they part of this high risk screening process?
Yeah, so my sister lives on the neighbor island, and so does my daughter. My daughter just moved to the neighbor island. But prior to her moving, we were trying to get her into the high risk. It's so hard to get in because of her age. Like her doctor, they wouldn't even give her a mammogram, 33. They said, no, wait till you're 40, even though she has all of this happening. So the high risk center is actually trying to help me get her in so that she can be seen. And my sister does, she's following up on that. It's just a little more difficult just because she's on the neighbor island. But yeah, so they know about it. They've been referred, and I'm hoping that my daughter can, yeah, get into this. But yeah, thank you. I would totally recommend that place to everyone. I had such positive experiences there, and very nice people, knowledgeable. I got second what is that called? When I first came out of surgery, they told me that they wanted me to do radiation, and I wanted a second opinion. I got another second opinion, and anyways, and so I just felt, and I didn't feel like I was being offensive. They were understanding that I wanted that second opinion, and it was the same. It was the same thing. They both said that the second opinion just said I didn't need that long of a radiation course. But I opted not to do radiation just because I felt that there was nothing protecting my organs between the radiation and my heart and my lungs and my vital organs. I had just my ribs because, my breasts are all gone. So I opted to not do that and do other things like hormone treatment and changing my diet and exercising more and things like that. And I mean, that was just my own choice. And my oncologist was in support of that and kind of tailored my treatment around those decisions. And so, yeah, and I'm on other types of medication to suppress the hormones. But yeah, I mean, I think what was good about it was that I felt I had that choice. And then I had the support of my doctors so that they could, change some things around. And they, they were upfront, told me what the risks are. And, I feel, and one of the things is that if it ever does come back anywhere else in my body, then at that time, if I need radiation, I know that that's always there. So.
Right. Good team. Good teamwork, it sounds like, for you. Thank you so much for sharing your story. And some of the comments we're getting both on Zoom and on Facebook are really mahalo to both of you for sharing your very personal stories. Evelyn from Maui says that her story is almost similar to Kaʻiu's. She took the same course of action. So a lot of really good comments coming in. JoAnn. Hi there. You've got a great story that really starts with your mother. Can you tell us about your mom?
Sure. And I would like to disclose early on that I am not a breast cancer survivor or thriver. I've not had breast cancer, but have probably my whole public health career has been around cancer, and a large focus has been around breast cancer. But mahalo to you, Jamie and Kaʻiulani. It just hearing your stories and hearing many other stories as well. In my lifetime, I've seen how much the landscape has changed. It's no longer just being at the mercy of surgery and radiation, and that's it. That it is so much more holistic. It's not perfect, and there's still lots more to do. But when I hear about the options that you availed yourselves to, la'au lapa'au and naturopathy, social support, it also, I appreciate that you share, because the need to advocate for yourself is so important, not just in cancer, but in any disease, and for our children as well. We're our best advocates, and for our health and for our family, but also how critical it is for social support, which you have such great, you are both great examples of how you reached out. And I just need to tell you, in sharing your story tonight, you're providing a lot of social support for people who may never talk to you, but have heard about your journey and some of the decisions you had to make, both during treatment and after treatment. You know, we always said nobody gets cancer alone. It's like your whole family gets it. But we know there's a lot more to do. I was telling Kaʻiu and Kim last night that, you know, cancer has been a topic in my family since I was 9 years old. My mother discovered a lump in her breast, and this was back in 1959. She was 38, young, and my dad had just died. So here she was, a single parent now with 8 kids. And she went under surgery, and she was told if it was malignant, they didn't do a biopsy. They were going to do it on the surgical table. If it was malignant, then they would remove the breast. And that's exactly what happened. She went under, she woke up, she had one less breast, but she had a radical mastectomy, which means they took quite a number of the lymph nodes out. And that was state of the art at the time of looking at trying to remove the cancer, but also looking to see if it had spread to other parts of her body. I was blessed because she lived to be 94 and lived a great life. And, you know, we had the opportunity of being able to say that we had a mom that survived cancer. And in my generation, because I am the generation before you guys, that was not the norm. If you talk to people who had cancer, it was about people who knew family members who had not survived cancer. And that's why, Jamie, you know, when your mom couldn't even say the word, when I started out in public health, it was almost the power of the word they were afraid of, that if you said it or if you got screened, you were asking for trouble. You know, so there was so much hesitancy about that. But my mom's gift to me and my siblings was that she talked about it. She showed us her skin graft on her thigh, where they took skin to cover where they had done the radical mastectomy. She showed us the scar. We watched it heal. You know, we were busy because now she was a single parent. I remember her dust mopping the floor an inch at a time, you know, because she just couldn't lay down and recuperate. There was just too much work to do, but she took it slow. And she was so open about sharing with us what was going on. In fact, there were times that she embarrassed me because we'd be in the shopping center and she'd be showing people her scar and she'd be showing people where they took the graft. And I remember teasing her, saying it looked like Spam, where they took the skin graft because it was kind of modeled, you know. But what she did, I realized the gift to us was that she demystified this medical treatment. She had it. She dealt with it the best she could. It was in the hands of the doctors at the time. And luckily for us, I can assume now it was probably caught early. And the surgery, while it was what we consider pretty aggressive today, you know, maybe it was early enough that she might have had a lumpectomy, but that was not the choice back in the day. So we could say that she survived it. The other thing I learned too is, you know, I watched prosthetics for breast cancer evolve over time. It used to be kind of this wedge of foam, you know, and then it became this sort of sack of silicone, and then it became this prosthetic with little holes where they put little ball bearings in it so that it had a little weight to make it realistic. And I think that also reflected what was happening in the treatment of cancer. So, you know, as I grew up, my motto to myself, I was the person saying, give me a mammogram at 35, because it wasn't a question of if I would get breast cancer. In my mind, it was a question of when I would get it. And so I wanted to find it early. And the more I learned with education and then working in public health, I learned the value of early detection. And that became a lot of, if you're familiar with some of the work and literature that we put out at Inihale, it was about early detection when cancer cure is more successful. And to hear the vocabulary of both of you in your treatment, it's almost, you know, that's the narrative today. And it has changed so much in the last, you know, 40, 50 years. So that's a good thing. Now there's just so much choice that it's really clear that the need for education, you know, I think, Kaʻiu, you talked about the time between when you had your biopsy and when you had your result. I don't know why that is. I know that when we developed our cancer patient navigation program, it was because we knew that a lot of the challenges for breast cancer patients wasn't because they were doing something wrong. It was because there were systemic barriers. There were system barriers that was not under their control. And I would suspect today too, because both of you were diagnosed during COVID, there's a real shortage of personnel too. So I can only give you some guesses of why it would have taken so long. But one of the reasons we developed cancer patient navigation was to have that helper navigate the system, because we heard so many stories of taking long to get word, or showing up for chemotherapy but not having orders, or being assigned to a clinical trial and not knowing where to go. And one of the things that was clear as we looked at cancer care was that the system is complicated and it's fractured. It really is fractured among the different institutions. And so navigators just literally help people navigate that system. But that's not the solution. That's just sort of the Band-Aid, right, of helping people through their cancer journey. So we know these are areas that still need to be improved.
I wonder, JoAnn, earlier in your career, you got to work with the women with the breast cancer support group out in Wāhine, and then it became a thing, the Wāhine Women's Cancer Hui or support group or something. But what strikes me, what I learned from that, and I was not a part of that, but there were some very key lessons about health education messaging that came out of that I still employ today. So I wonder if you could tell us a little bit, summarize that project, but tell us what the lessons learned from that are.
So I was so fortunate. I really was fortunate in that when it came to breast cancer, there were actually some large research projects that were done by Hawaiian women for Hawaiian women, and by a Hawaiian community. Wāhine was the first, and this was very unusual. This was in the late 80s, early 90s, the Wāhine Coast Comprehensive Health Center. We all knew cancer was an issue. We just didn't know what to do about it. And we were not at the tables that were making decisions or getting research dollars. We were out in the community saying, what do we do about this? We didn't want to keep sharing stories about, women not getting screened or how to address that. And even when they did set up clinics for affordable screening or free screening, Hawaiian women didn't go. I mean, you'd see Asian women lined up for the free mammogram, but you didn't see Hawaiian women. And one of the things I learned, so the project you're talking about specifically was a grant that the Wāhine Coast Comprehensive Health Center got. And Rio Banner, who was the medical director at the time, was the principal investigator. And, it was just one of those weird things where the community was talking about it. They had a little construction crew out of the Wāhine Comp, and key people were Shelley Enos and Doris Siegel Matsunaga and Ho'ipo Di Canberra. So these were just powerful women, and they wanted to know what to do. And there was a grant that came out to increase screening for breast and cervical cancer. And they got support from someone at NIH, Dr. Claudia Baquet, who said, write for this grant, do it. But then we had to think about how do we do that and what do we do and what should we do that's different? And luckily, not luckily, but it took 2 years before the federal government got the grant announcement out. And in that 2 years, this community group talked a lot about what they would do differently. So one of the things they did was they really researched, what did people feel about screening? How did people feel about cancer? So just that, what was the sentiment and narrative in the community? They did surveys 3 times during their 5-year project. One of the things that was awesome about what they did is, even though they subcontracted and hired SMS Research to do the survey, they insisted that SMS Research hire women from the community. And I took that lesson home of capacity building within the community while participating in research. So it created employment for 8 women, and they did the survey. It followed very strict protocols, and they got 600 respondents at all 3 times, at the beginning, the middle, and at the end. So we have a great amount of information about attitudes and practices and health-seeking behaviors. Then they decided that their intervention was going to be, and this is when navigation was introduced. It wasn't introduced nationally. It was already going on in Harlem Hospital with African-American women, but they, independently of of Harlem, they said, you know, we need to navigate this system, and we need to help each other. As you folks have talked about your support system with Diane and the people who you could reach out to and support you. So they trained navigators. They put together a curriculum. They decided that they would have these, they called it like a Tupperware party. They would have it hosted at somebody's house that had fair warning so they could clean up. Because initially we said, maybe we'll just have people go door to door and educate women. They went, I don't want you coming at my house and talking about breast and cervical cancer with my husband home. And so we said, well, what would be the appropriate way to do it? And what they decided was they would host these meetings. And I know all of you remember Rel's son, our champion surfer. She was battling with breast cancer at the time, and she was one of the first navigators. And so she was very instrumental in facilitating and being part of these education sessions, talking about, as you, Kaʻiu, and Jamie have done tonight, sharing her own journey and her story. Also just educating on why this was happening in the Hawaiian community. I'll be honest, I think, like myself, I thought this happened in all families across Hawaii. And what we learned was the burden of breast cancer was highest in Hawaiian women, and still is. And in fact, it was not only highest in our own homeland, but when we looked at national data, we were second only to African Americans and Alaska Natives. So this was information we just didn't have. And as we got it, we went, well, what's happening here? And so they created their Ho'okele navigators to share information. And that was so instrumental in that they did reach significant numbers of increasing breast and cervical cancer screening. The other really cool thing that they did was, as they were doing this project, and it was a 5-year R01 project, one of the things we learned in the survey is women were not getting screened because none of the clinics were open when they got home from work. They were working women. So the Wāhine Comp opened a night clinic, and I want to impress upon folks that a lot of the solutions and a lot of the things that are helpful is not rocket science. This is about support. This is about systemic barriers that can be changed. So they actually were very successful in increasing breast and cervical cancer screening on the coast. The other thing that it taught me, and it really did shape my methodology for anything I did in research with Imihale, not just the Waianae Project, but what was going on in Molokai with the diet study, is that communities know their problems the best. They are the most innovative about the solutions because they understand health-seeking behaviors and what is acceptable, not just what is the most scientific thing, but what is acceptable in the community. And when they can have control over that it's successful. And so, Imihale, of course, was around at Papaʻololokahi for 18 years, NIH-funded project, and we were lucky in that it had a whole cancer education component. So I do invite anyone to go onto the Papaʻololokahi website, because even though Imihale has sunsetted, the education materials are there. And there's also videos that were done by our Hawaiian survivors, but there's one in particular that were done by young Hawaiian women with cancer, those that are not eligible for screening. So Jamie, as you're talking about, not getting a lot of support for screening of your daughter, these are 3 young women who were under the age of 30. I think that Otis was 31, childbearing, one was pregnant. What were the questions? And, these were young women who doctors didn't even discuss cancer or breast cancer.
Right. You're so right. And I did put the ʻImihale website there because there's so many good resources that I continue to share with folks all the time, especially those with cancer. There's the what to do, there's the 3-ring binder. And I think one of the best lessons that I learned from you, which I know you learned from the Waianae Project, is when we do health education materials saying you gotta say, for example, get a mammogram because or you're going to die, you want to live longer. And that didn't really resonate with the women, with Hawaiian women. But when the language was changed and now our brochures give messages such as get a mammogram now so that you can be there to care for your families, that compels women to act, Hawaiian women to act. And I think that's so important today with the way we shape our health education materials. So yeah, thank you for introducing that, ʻImihale. There's so many good resources and I'm sure we can come back to them, but I wonder if I could, so Jamie, Kaʻiu, we know that some of your care continues, treatments, and can you tell us a little bit about how you've changed the way you take care of yourself now? How has this year-long journey impacted the way you take care of yourself or take care of your family, or perhaps the way others take care of you? What has changed? What have you intentionally changed in your lives?
I'll talk. Well, I really only took you through the first 10 days of what I went through. And I really wanted to talk about what happened afterwards. And I know we had talked about coping, like Jamie said, having a support system and really just having Jamie to call on all the time. And when we really did, compare notes, but I also had a couple other friends with breast cancer and I talked to them and I wanted to know what they did and how they were feeling. I had a friend that was battling brain cancer and all the things that she went through. And so part of it is really learning for yourself and taking some power in yourself and choosing what you do. I continue to work on diet, continue to take my supplements, continue to do la'au. There are a couple other practitioners that also gave me some, like a salve to rub on my breasts and things like this. And so the journey right after the diagnosis was really to get myself as strong as I could get myself as we waited. And I chose to do the lumpectomy. I had, I think, 15 days of radiation, and I'm now on a hormone blocking pill that I need to take for 5 years. But during that, it was working with everyone to get strong. And then as we went into the surgery, and I knew what the surgery was going to be, and I knew what time I was going to have surgery, it was my naturopath that said to me, go out into your circles and let them know what time, let them know what's going on, and ask them to envision a healthy surgery, that the doctors, it's going to be successful. They're going to do what they wanted to, that they need to do. You're going to recover well, and have them all do that. So, I have a lot of circles, my personal friends, my halal sisters, my work crew, my healing practitioners, just different circles. And so I went to all of them. And, we were talking earlier, like I didn't announce to everybody, because it also takes a lot of energy, I think, to tell a whole lot of people about your diagnosis, but letting people know as I felt comfortable with these bigger and bigger circles. But so really letting everybody know what was going on within these circles. And at, when I went under surgery at 1:00 that afternoon, if they could all collectively be and spiritually be supporting me from afar. And that's what we did. The anesthesia kicked my butt, and they wanted me to stay overnight that night because I just couldn't get out of it. I called my friend who's Healing Touch. She helped me. I went into the hospital at 9 a.m. and I didn't get out till 11 something that night, got home at 12. And I had been just taking some homeopathic arnica in the morning. And when I got home, and I felt like a bus hit me, of course, by the time I got home. But I got up at 6:00 the next morning and I actually felt pretty good. Like I never even took a Tylenol from my surgery. And I continued. My naturopath asked that before I went in, that I prepared all these really dark green soups and different types of foods, you know, the oranges, the reds, the purples, and that whatever else I was eating, I was to eat certain things every day after the surgery to get my body strong. And so that was, you know, those are just some of the lessons that I had, that you could really work physically, spiritually, emotionally to prepare yourself for this. And that you, if you, and to build the support system, to being as in control as you can be was important to me. So even with the la'au, like I wanted them to pick it, but I wanted to make it myself. Like I wanted to have a hand in making that la'au that was going into the body. The food, I wanted to, you know, prepare and do all of the food. So as much control over what was happening to me that I could have during this time was really my lesson. And so it continues today. I mean, you know, it's not easy to be 100% all the time, but the other thing is stress relief. We were just talking before we got on about how life is so busy. And that's the one thing I'm working on, is really to try and to lessen the million things that I'm doing every day, but I'm continuing to work on my health, continuing to eat protectively, and with the foods that I feel are really protective. I still take some supplements, I still take la'au, and exercising, walking every day, and just trying to be good to myself.
Good for you. And Jamie, what changes have you made? You continue. You told us earlier that you have treatments that continue, but how are you taking care of yourself?
So I looked at, so part of my support system are my first cousins they're older than me. I actually call them auntie, and they both got diagnosed with cancer within the last 5 years, but stage 4, different kinds of cancer. And they opted to not do radiation nor chemo. And they both are in remission. And they went the homeopathic route. And so I took some of the things that they were doing as far as diet, eliminating some things from my diet, and putting in more healthier organic foods, and different supplements. Immediately, I did that immediately. I changed my water. I drink different kinds of water now, and just, you know, and then I had started exercising prior, but then I had stopped during the when I got diagnosed and all that, and the surgery and stuff. So then I went back and got lit, and have been a lot more serious about exercise and more committed to it, and the type of exercise that's appropriate for my age and my body. So yeah, and so I've been enjoying that, and then I've slowed down a lot. I'm not as before I used to like to go out and hit the town with my girlfriends, with Kaʻiu and the other ʻAha Wahine folks, and just have fun, going to retreats. I just rather stay home now, and just stay home. I don't know what it is. It's just, I don't know. I just want to stay home, and spend more time with my family when I can, with my grandchildren. During this time, my youngest grandson pretty much lived with us, with my mom. My mom took care of me. My mom came, and my parents live on the neighbor island, and she was here, and she took care of my grandson, and between my husband and my mom, they took care of me. And so that brought a lot of healing and a lot of joy, and just enjoying those moments with the little one, with Kau'i. He's 2 years old. So yeah, I think that, you know, you just get a different perspective on life as well. And you know, even though work is important, my work is very important, but it's not number one. It's not priority as much as my family and life is. So yeah, I think I've made definite change. Everybody's like, who is this? My husband, who is this? How come you're home? How come you want to stay home now?
How funny. Well, I mean, I see the patterns here. You've both adjusted your diets, you get more exercise, and most importantly, and let this be a lesson to, all of us, is it to reduce that stress level. And so, JoAnn, you told us earlier that you regularly get mammograms because of the history with your mother. What other things do you do to make sure that you are protected?
Yeah, I do. I'm pretty adherent to screening, not at giving up candy or chocolate, but I do get screened annually. I do breast checks, and because that's the thing I've been most paranoid about with my mother's history. But I just want to tell both Kaʻiu and Jamie that, when I said earlier that, you don't get cancer alone. It really does affect the whole family. But I'll be honest, and for all the cancer patients and friends and family that, I've had an opportunity and honor to help, it is such a learning lesson for the family. And it's not, even though it's traumatic, I'm not going to belittle that. When I look at how kids help mom, or sisters that just come in, or friends that, come in and support, that's to me a gift and an opportunity for them to, one, learn what you're going through, but also think about somebody else besides themselves. I mean, it's such a selfless thing. And I see that all the time with cancer patients. I think both of you also talked about taking care of the things you can control, exercise, diet, and that I found has been a real key thing, and that's important. And I'll tell you, my oncologist buddy, Dr. Chong, who we call Dr. Krabby, he makes it very clear.
No, he calls himself Dr. Krabby.
He does. That's his email address. But, he said people live longer because they have the support of others. That's medicine he can't prescribe. I also wanted to let people know that cancer care and treatment is advancing so quickly. So when you talk about hormone treatments or, different kinds of screening, and there's even cancers that are slow growing where, they may detect it and they want you to watch it and wait. That would make anybody absolutely crazy. But there's also a chance that you could overtreat. But I think people need to know that the advocacy for yourself, asking for another consultation, asking for a tumor registry, that's very common in the cancer field. And I know we don't want to hurt our doctors' feelings that we didn't believe them, but that's one of the things we always encourage people to do, is seek other advice from other professionals. And as Clayton has done many, many, many times, it's almost part of the treatment, is share a case with his peers so that he has collective thinking about what's the best course of treatment. And I love, we have to grow more Hawaiian oncologists as well, who know the importance of la'au and know the importance of the support and the spirituality. And Kaʻiu, thanks for sharing about going out and in informing your circles. When I let a friend of mine know that my uncle had lung cancer, she immediately called out our American Indian Network and put his name on their list, and he lived 7 years, which no one expected. So I was so grateful for that. But
that's awesome.
So kudos to you too. Please continue to share your story. So much more effective than half the medicines we keep using.
Absolutely. So Jamie, Kaʻiu, you have a closing thought you want to leave the listeners? So people are tuning in because they're hearing your stories, and it may resonate in ways that you'll find out tomorrow, or you may never find out. But I think that's the most important thing, is that you're sharing your stories. They're out there. What closing thought do you have to share?
I think, we talked a lot about it. For me, it's, of course, I get your mammograms done. Like I said, I hadn't had mine in 10 years. And so I feel like someone overhead was guiding me to make sure that I got it done when I got done. But really being your own advocate learn how to be your own advocate is so important, and trusting in your gut and doing what you have to do.
Beautiful. Mahealani.
Yep, I would agree. I said some of that earlier. But also the sharing the story is important because I know I was on a lot of people's prayer list, and same thing with Kaʻiu. You know, had all these positive thoughts, and I would get lots of texts, and that sometimes would take you over, you know, from having a real crappy day or crappy time because something's happening to, wow, this is, you know, I'm being cared for, and just kind of can lift you up. So for me, it's like I want to do that for others too, and making myself available to lift others up when they're going through different types of journeys like this. So if anyone has opportunity to do that, I would say like that is just as important as, you know, going to a doctor's appointment. So.
And you all three have lifted up others in many ways too. So know that all the care that you receive is because you also have cared for others. On behalf of all the others, mahalo nui. I want to thank these three brilliant women for joining us this evening. Jamee Miller, Kaʻiulani Odom, JoAnn Tsark. Thank you to all the panelists. Thank you to the sponsors do we have slides? We'll have them in a minute. Thank you to Le Maile and Napua for providing all the tech support. You see in the chat and in the you see in the comments section, and tomorrow, please fill out the evaluation. It really makes a difference to how we plan this programming for all of you. Mahalo nui to Hawaii People's Fund, to Papaʻolelo, to OEV TV, e Kolumea Nui, the University of Hawaii, the Roots Program at KKV, and Maili Kukahi at Aina Momona Academy. Mahalo to all of our sponsors. Our next program, ʻAha Wahine Kūhinapapa, will present to you on Thursday, November 17th. The topic is Wahine sexuality with Kumuhula Mehano Kalahind and Dr. Aukahi Austin Seabury. And this is going to be a dynamic conversation. Mahalo to tonight's guests. We look forward to seeing you again in November. Thank you for joining us. To all the Wahine and Wahine lovers who tune into ʻAha Wahine Kūhinapapa, aloha, aloha nui kako.
Mahalo Kaʻiu and Jamie. You guys are awesome.
Aloha,
For
mahalo.
sharing.
Mahalo. The hour really goes by fast, yeah.
So fast. That's why I looked up and I'm like, oh, there's only 15 minutes left.